Good morning, everyone. On behalf of the ACNJ Board of Trustees, I'd like to welcome you to our 7th annual breakfast. Please join me in thanking our musicians from the Arts High School Latin Band in Newark who greeted you this morning with their music. We're so glad that you're joining us this morning as we celebrate ACNJ's many accomplishments done in partnership with many of you that are here today, our parent advocates, our funders, our community partners, and our supporters. We're very proud of our staff and some of the real out-of-the-box thinking that they've provided. It's a pleasure to be on the ACNJ board and to support the work of our staff. Lana Lee, our media relations manager, has created a video to give you some highlights. It's brief, which we want to show you now.
Extra, extra, read all about it.
This year, with your support, ACNJ has helped thousands of kids in New Jersey.
Every dollar that we invest in our children at the very beginning can pay us back many times over throughout their lives, with a return of up to $9 for every $1 that we invest.
Advocates for Children of New Jersey looked at almost half of all the centers in the state and found programs are offering 10 less seats for infants and toddlers, even if they have space, because they don't have adequate staffing. State lawmakers now taking steps to help. Last month, Governor Murphy signed one of the bills into law that would create a $28 million grant program to help centers make more spots available for infants and toddlers.
ACNJ continued to inform and educate people with resources and data.
Good morning, Patterson. What this data does drives all of us to do what we do as far as our mission is concerned.
Good morning, Newark. Good morning, New Jersey. Good morning, moms. Good morning, child caretakers and educational professionals. A huge debt of gratitude to ACNJ and all the fierce women who lead in not solely bringing to the forefront on an annual basis the needs of our families and children, but for consistently reminding us that they are the compass of where we should be when it comes to policy and good common sense practices in the state of New Jersey.
We also lifted up people's voices. And now for the biggest news.
My grandma, Cecilia Zalkind, after 38 years of serving ACNJ, is retiring.
What does retiring mean?
Retiring means you quit your job, you never do it again, and you could hang out with your family and you do whatever you want.
Retiring means you quit your job and you don't get a new job. You're just done working.
And what do you want to do with Grandma now that she'll have more time?
I would like to camp and make s'mores.
I would like to bake sweet treats with my grandmother.
Thank you for helping children big and small.
Don't forget to celebrate with us in March.
you. I don't think I can do this. Thank you. Thank you. I kept saying this was going to be our normal breakfast. I should have known there were surprises, but I didn't expect that surprise. That was, where's Lana? Thank you, Lana. And that was really a wonderful surprise. And I think there must have been some coaching involved. Because those of you who were with me, where's Sarah, who witnessed this, were with me last week when I received a proclamation from the New Jersey Senate, which was wonderful. And I had my family there with me and met my daughter and grandchildren at their car. And he got out of the car and said, "This is my worst nightmare." "Did you want me to wear this bow tie?" So thank you for the coaching. I appreciated that. And thank you all. Thank you all for being here. I can't say how incredible it is to look around this room and see how many people I know, but also how many people I don't know. Because as we're looking toward the future, it's exciting to see that the future is here with all of you. And it's so wonderful that we're here together after an incredibly challenging time. I think that to me, it's a testament to the fact that we not only survived, but in some ways thrived on the challenges of the last 3 years. It's been an incredibly challenging time for us, certainly, but even more important for the children and families that we care about. And you all have certainly risen to the occasion. I think the video highlighted some of the remarkable success this year. Legislative, Thriving by 3, which Senator Ruiz spearheaded, along with the Young Child Tax Credit, to have those signed in this year, have them introduced and signed and put in the budget in 1 year is just nothing short of remarkable. And we are going to be welcoming Senator Ruiz in a little while to really acknowledge her extraordinary efforts. She has taken on her role as Senate Majority Leader in an incredible way, and she has put her leadership toward children, especially young children. We have seen the continued expansion of preschool, which is now in several hundred districts across the state. If you look at the state budget, it was a remarkable budget for children and families. The investments, not only in the present, but in the future, are really remarkable. We're in the midst of implementation of the second in the country Universal Home Visiting Program. These are remarkable accomplishments in any year, but to know that they happened in this year coming out of the last 3 years is nothing short of extraordinary. And it is, I do think from challenge, I think we learned a lot during the pandemic. For me, I think we listened in a way that we haven't before. We listened to families, we listened to children, we listened to their experiences during the pandemic. We learned from that. We implemented policies as a state, I think, to address the pandemic, which actually turned out to be the things we should have been doing all along. And I think, you know, to me, looking around this room, that's something we can't let go of. This is our opportunity to make sure that we not only maintain this, but build and grow it. This is just an incredible opportunity. To me, however, the real success is in this room, in all of you who stepped up to advocate. I'm so happy we have members of our Parent Leadership Council here. Can you just stand? I'm going to put you right on the spot and ask you to stand up. Thank you for being here today. When I talk about the fact that we listened and learned a lot, it was from parents like those who have joined us today, who serve on our Parent Leadership Council, who advocated last year in a way that convinced us that having real stories, real people, and authentic voices are critical to advocacy, so thank you. And our emerging youth council in Newark, I don't know Alana, if there are members of the Youth Council here today, because I'll put them on the spot too, to see young emerging leaders in Newark is so exciting. It really makes you think about the future. Our community partners, many of you in this room are involved in childcare, which has emerged as certainly one of our biggest issues and a big issue for the state. You not only have worked to ensure that your programs survive and continue to serve the families who need you, but you've been incredibly innovative and you've advocated. I think everyone has stepped up in a way that convinces me that the future is really in good hands. And speaking of the future, you all know that this is a new chapter for ACNJ and for me. I'm turning the page on my own chapter. I have been rereading all of Nancy Drew with my granddaughter. We have our own personal book club. And there's some comfort and lessons in that because there are always a few little surprises in those books, not as many as I thought there were. But in the end, hope, positive prevails. And I'm looking for that, for both of those things, and also for the surprises. And I have to say, it has been an incredible privilege and honor to get to know all of you and to work with you. If I look back on my 38 years, that's what's been most important to me. It's all of you and everything that you do on behalf of children and families. And I'm very excited about the next chapter for ACNJ, new leadership in Mary Coogan. Where is Mary? Right there. I am excited for Mary and for ACNJ about what she will bring to the next chapter of ACNJ. And our great board, can I ask our board members to stand up? I think we have a phenomenal board and a staff. I'm going to ask the staff to stand up. Because while we're looking towards the next chapter of ACNJ, they are focused on the values, the commitment, the importance, the priority of children and families that have made our work so important and so successful. And to all of you, again, I'm excited. You're part of the future. Your experience, your ideas, your persistence, and your courage. I think over and over again about those moments looking back when people made decisions for children that were not necessarily decisions that supported them personally, professionally, sometimes even put their own programs at risk, thinking back to those original decisions about Abbott Preschool. But over and over, you have stepped up for children. And I think that is the next chapter that will continue. So thank you. It's a pleasure to be here. I'm going to turn this back to Charlie because I don't think I could talk anymore. Thank you.
How about some more applause for Seal? So in my instructions for today, I was told I could make a few brief remarks to transition from the video to our panel, but I'm going to take a little liberty and take about 30 seconds. I watched that video about 6 times yesterday. I was just enthralled with Seal's grandchildren, the way they presented, the way they handled things, the way they said that their grandmother would not be, or trying to send her a message that she wouldn't be working anymore. But I know that, and we talked about this at our last board meeting with Seal, Seal will always be a part of ACNJ, and ACNJ will always be a part of Seal. And Seal will be helping us as we transition into the new year in our work in early childhood. And we're so thankful and so happy that her grandchildren will allow that in between baking those cookies and making those those s'mores. So we have a very thought-provoking panel discussion for you this morning. I'm back to my scripted words, which will be moderated by Dr. Jasmine Reyes-Portillo, Assistant Professor of Psychology, Associate Director of Clinical Training, and Director of the Youth Mental Health Services Lab at Montclair University. Dr. Reyes-Portillo will be joined by David Adams, Chief Executive Officer of the Urban Assembly, and Tracy Paris-Benjamin, Director of Clinical Design, Community Health at Horizon Blue Cross Blue Shield of New Jersey. Their bios are in your program, starting on page 5. Can our moderator and our panelists please come up? Thank you.
So thank you everyone for joining us this morning. Today we're going to be discussing possible solutions to the mental health challenges many youth are currently experiencing. So before beginning our discussion today, we thought that it would be helpful to provide some context related to the current state of mental health disorders and mental health service use among children and adolescents. And so since the Surgeon General's advisory report on youth mental health last December, there have been several news articles and stories alerting the public to the mental health crisis that youth are currently experiencing. However, before the pandemic, youth mental health was already an important public health concern. So for instance, it was estimated that nearly 1 in 5 children were suffering from a mental, emotional, or behavioral disorder, such as depression, anxiety, attention deficit hyperactivity disorder, or a disruptive behavior disorder. Additionally, data from the CDC's Youth Risk Behavior Surveillance System, which is a biennial survey of high school students in the US, really was pointing to increases in feelings of depression, suicidal ideation, and attempts among high school students in the past decade. Most alarmingly, between 2007 and 2018, suicide rates among children between the ages of, youth and adolescents, between the ages of 10 to 24 increased by 57%. After unintentional injury, suicide is the second leading cause of death among 10 to 14-year-olds and the third leading cause of death among 15 to 24-year-olds. There's also emerging data that there are when we think about suicide rates, suicidal ideation, and behavior, that there are some disparities, so racial ethnic disparities that are emerging. Recent findings from the CDC report that American Indian, Alaska Native adolescents have the highest suicide rate in the nation in comparison to other racial ethnic groups. Historically, in the US, Black youth have had lower rates of suicide and suicidal behaviors compared to youth of other racial and ethnic backgrounds. However, recent statistics indicate a significant increase has occurred in the past decade, pointing to a disparity. So for instance, in a 2018 study by Bridge and colleagues, Black children between the ages of 5 to 12 were 2 times more likely to die by suicide compared to their white counterparts. Now, it's undeniable the COVID pandemic has had this enormous effect on communities across the country. And young people have been especially impacted by, when we think about how their everyday lives are just completely changed and altered. So we're thinking about disruptions in school, the ability to interact with peers and family, not to mention the stress and trauma associated with the loss of loved ones. All this disruption, as you can imagine, has only served to accelerate the decline that we were seeing in youth mental health. And so recently in 2021, the CDC conducted the Adolescent Behaviors and Experience Survey to assess the impact of COVID-19 on high school students' social and psychological health. And so what the findings revealed is that about a third of students reported experiencing poor mental health during the pandemic, and about 44% of students described experiencing persistent feelings of sadness or hopelessness. Now, when you consider the different questions that were asked, one sort of significant trend that emerged is that female students and students identifying as LGBTQ were more likely than male students and heterosexual students to report feelings of depression, suicidal ideation, and making suicide attempts. Now, with regard to racial ethnic differences, there were some significant findings that were found. However, there wasn't a consistent pattern that emerged. However, one thing that is notable is that Native American or American Indian Alaska Native youth were more likely to report having made an attempt in comparison to white, Black, Asian, and Latinx youth. Another recent study by Jones and colleagues found that emergency department visits for suspected suicide attempts were 50% higher among girls and and about 4% higher among boys from February to March 2021 than the same period in 2019. Early estimates show that 7,000 suicide deaths occurred in 2021 among 10 to 24-year-olds, and this is about a 6% increase from 2020. Now, while the pandemic has affected all children and adolescents, the experiences of disruption and adversity have not affected all youth equally. The pandemic has really highlighted existing inequities in our society, particularly the impact of systemic racism and discrimination and how that can adversely impact mental health. Now, the CDC's ABE study also found that about 1/3 of high school students reported being treated badly in school on the basis of their race or ethnicity. African American, Asian, and multiracial students were more likely to report these instances of perceived racism. And the survey also found that there was a link between having had these experiences of racism or discrimination in school and that leading to increased mental health symptoms and also feeling disconnected from school. Despite these elevated rates of mental health problems, unfortunately, only about 20% of children in need receive care from a specialized mental health provider. And for some time, and for a good amount of time now, data suggests that youth of color are less likely to receive treatment than white youth. Some families can't find mental health care because of lack of providers in their area. Other families have to travel long distances or be placed on long wait lists to receive care. High costs, lack of insurance coverage, and the time and effort involved can really make it hard for families to get the mental health care that they need, particularly for their children. In addition, cultural attitudes and stigma for mental health problems may prevent families, particularly those from minoritized backgrounds, from seeking services. And so, it's pretty well documented that untreated mental health problems increase risk for a whole other host of problems. So things like physical health problems, increases risk for substance abuse problems, suicide, school dropout, underemployment. A recent study by Hoffman and colleagues found that the youth that were most likely to die by suicide lived in areas where there are very little healthcare providers, right? And so there definitely is this direct link between service availability and death by suicide. So with these issues in mind, The panel would like to discuss the following questions. And so I'm going to join the panelists now in the front here. But let's start out by considering, what do you think are the ways that we can ensure access to mental health services to the majority of children of all backgrounds? And so, Tracy, you just made eye contact with me, so I'm going to go with you.
All right. Good morning, everyone. It is a pleasure to be out in the open. I want to acknowledge that. I think that's so imperative. I am a social worker by training. I am a director of community health and health equity. I've been at Horizon for about 10 years now. And this work, in terms of thinking about addressing health inequities and addressing health disparities, has been in my DNA for as long as I can tell you. I think the great aspect of work that we can think about now is the ability to speak candidly and frankly about structural racism and how it impacts the healthcare system. So to talk about the horrible statistics that Jasmine just went over, it would be dismissive not to address the fact that it is structural racism that has dictated a lot of what we see. And then when behavioral health or mental health was separated from physical health, that created a further disparity just in terms of how we look at mental health. So a big portion of this work requires us to destigmatize mental health and to consider it as a part of preventative care. I think it's from a perspective of making sure that folks at the C-suite, and that is one of my primary goals, is that making sure that the voice of the member, patient, client is always in those rooms. One of the things I find is that finances, obviously, which is important, dictates a lot of where investments go. And the voice of the member, patient, client, and I always say that because I've operated in all three different areas to give respect to member, patient, client, is that it's not often heard. As a Black woman, what I would say is some of the biggest challenges around mental health starts in the home. It starts in the home in terms of accepting and understanding that mental health is imperative. It is just as if you have a diagnosis of diabetes and you have a treatment that is needed, there's no stigma attached to that. It's almost as if when you talk about mental health, the perception comes as if it's a flaw, especially in the Black community. For women, I will speak candidly, Black women have to wear this cape. And it is an invisible cape. And it comes from a perspective that people often say, well, you're a strong Black woman. So because you're a strong Black woman, if you have anxiety or you have depression, that is a flaw on who you are as a person. So to admit that you are dealing with those challenges are very, very difficult. Your children then perceive and they see that, so that innate becomes a part of how they operate. So there's not one fix here, and I know I'm giving a very long-winded answer, but that's where I'm going. There isn't one fix. I think it starts with organizations like Horizon and others like ourselves to really think candidly about how we normalize and destigmatize mental health. I think that's where it starts. I'll give my panelist friend here an opportunity to speak because I have a few more suggestions, but I'll pause there.
Well, thank you so much. David Adams, Chief Executive Officer at the Urban Assembly, and I am very happy to be here in New Jersey. I was telling my wife, as I get around the country to do things, this has been the shortest wake up. I live in Union, about 6 minutes away. I looked at the time I had to be here, I looked at the time I had to wake up. It was a very, very pleasant morning. And so I think one of the things that's important in this, and I'm going to be succinct here, is what did the pandemic teach us about the role of connection in mental health? When students and young people were disconnected from the larger society, these inputs, these pro-social institutions that help young people find connection in themselves, their mental health deteriorated. What does that teach us about the role of these institutions in promoting the mental wellness of all young people, right? It's a straightforward conversation. Mm-hmm. It's a straightforward conversation. The concept of mental health as something that's either bad or good, right? Either you have it or you don't, rather than this notion of your mental health being invested and nested and these systems of social support that help create coping and resilience and problem solving. It was laid bare by the pandemic that said when you remove students and young people from these systems of support, they struggle and they suffer. And you saw the statistics with regards to who struggles and suffers the most. And so the answer to this question in terms of mental health services is to kind of reshape what we think about what mental health is and what we do when we think about social and emotional development, when we think about what it means to invest young people in systems of social support that help them solve problems and to help them connect to themselves and the institutions around them. And that is mental health supports. Those are mental health services. And it starts with parents, it starts with teachers, it starts with pastors, it starts with supportive adults in every young person's environment who helps them move along in their life.
So it sounds like you both feel that, one important approach to solving this issue is really thinking about prevention. So prevention is key. So I think this is a good segue into the next question about long-term changes. So what are the long-term changes you think have to happen in our mental health system to help youth in need and promote resilience and well-being?
You want me to take that one also? I'll go first. I think the importance in going to what my partner has just alluded to is the importance of partnerships. No one organization or system can do this work alone. One of the things that was really highlighted for us at Horizon during the pandemic was utilizing clergy. It might seem very, very easy to those in the nonprofit space, but to a large payer system, it just wasn't the system that we thought about partnering. And at the height of the pandemic, when it was extremely difficult for individuals to receive a vaccine or get education or get information about making an informed decision, we made a conscious decision to actually reach out to local pastors and clergy and to utilize their homes of worship as an opportunity to become a vehicle to, number one, to educate people about the importance of the vaccine, but also to make an informed decision. And in doing so, we went out to communities, and not specifically Horizon members, but to communities most disadvantaged and struggled to receive the vaccine. And what that taught us during that moment was the importance of partnerships, of having collaborative partners and expanding health outside of the four walls of the hospitals. That to have relationships only with doctors or only with nurses or members of a care team is a very limited scope of health. We had to then also partner with schools. So we started working with schools and offered vaccines at schools and worked with, our local, pharmacists to do so. But it gave us an opportunity to educate members, but also those partnerships to support each other in providing care. So what I would say is to reimagine health beyond the voice of the payer, the voice of the school, the responsibility of the hospital, but to work more collectively to approaching mental health as well. From my lens, what I see is a lot of inequities and disparities that exist based on who is involved in the systems of care. You need individuals who truly understand the communities. I would say we have actually ventured to invest in programs utilizing community health workers. It has been a great resource. We've hired 45 community health workers throughout New Jersey. These community health workers are from the community. They are vested. They understand the needs of individuals, and it's almost like a peer-to-peer symbiotic, like symbiotic type relationship in some way. And I feel what that does is it gives latitude and allows for people to feel that their voice is heard. And when you feel like your voice is heard, the opportunity to be vulnerable and to talk about the fact that you are struggling and it's not a flaw. And I will continue to say that because the reality is as much as we talk about mental health, it is still very much seen as a flaw. I had a colleague recently say that he went to the doctor and he mentioned to the doctor that, sometimes he gets anxious. And he's a professional, he's a Black male, And he said that he felt as if the doctor was like, oh, this happens to everybody, just kind of brushing it under the rug because of how he looked. He looked like a professional. He looked like things were together. And I think that happens more common than we think. So from my perspective, again, I would say there are opportunities for large systems, even like Horizon, to think more candidly about how we invest in behavioral health and mental health. We've started that by taking in behavioral and mental health services. We manage that internally now. The other thing is thinking of non-traditional resources like texting capabilities, especially for young people. We contracted with a company called MindRight this year. It allows for youth to actually text a mental health specialist to engage and ask questions 24/7 without having to be face-to-face, meeting people where they're at and providing them with the services that address their particular need in a customized fashion.
Yeah, thank you. Yes, we're thinking about this notion of resilience, right, and well-being. And Tracy was talking a lot about managed care and how we support the ability of young people to access that care and where that care is at in the pandemic. And as you were talking, I'm thinking, I'm an educator, and we run 23 schools in New York City, and we do school support across the country. And I'm like, what is an educator so invested in this notion of social and emotional development and mental health? What is it about education that becomes the center for connection for young people? And one of the things I think is this notion of prevention versus promotion. Prevention versus promotion. All right, so I'm just gonna do a quick poll here. So if you stick with me, raise your hand if you did physical education class when you went to K-12. Have you ever been to physical education? All right, listen. All right, so we got everybody here. That's great, okay. Now, raise your hand if you're still doing any of the sports that you learned in physical education. Anybody? All right, so we got some folks here. All right, we got the hardcores. All right, I appreciate you. I see you. All right, I see you. And so the reason I'm asking this question is the job of physical education is not to prevent heart disease, right? It's not to prevent obesity, as it were. It's not to prevent people from struggling in terms of their physical health. The job of physical education is to promote healthy lifestyles. It's to teach young people how to move, how to eat right, how to use nutrition to thrive, right? And that's that reframe when we talk about social and emotional development as well. The job of teachers, the education system, of adults, it's not to prevent young people from having mental health challenges. It is to promote their ability to thrive in society, in community, in their homes, and without and beyond. And that reframe means it's not about thinking about am I struggling with depression per se? It's how well am I using my coping skills to solve the problem of mood regulation? Because we all have mood regulation challenges, right? I know. I have that all the time, right? But sometimes it gets more intense, and without the supports that we saw during the pandemic, it becomes overwhelming, this notion of a crisis, of an incident overwhelming your coping skills, right? So our job, and when we're talking about this notion of youth resilience, is to look at these institutions, our parents, our clergymen, our schools, our nonprofits, our boys and girls clubs, our youth sports was a huge thing. Let me just tell you, I've got 9,000 kids in the urban assembly. We have 19 high schools. There were a lot of young people who missed sports. A lot of young people who missed prom. I mean, not a lot of young people who missed calculus. I'm not gonna lie. All right, but those things had connection to them. And so this question of resilience is a question of connection. It's a question of how we are making connections with young people, how we are teaching them to thrive. How are we using words that are asset-based? How do we teach them to manage their emotions? Because they're gonna have to do it in life. How are we teaching them to build relationships? Because that's a key protective factor across all mental health issues. And how do we teach all of the folks who are working with young people to interact with them in ways that maintain, elevate their well-being, support our schools, support our nonprofit institutions, and support the kind of interactions that young people need to thrive. And that's where this question of young resilience is around, youth resilience. And this is a question of moving from mental health to mental wellness, from prevention to promotion, and moving from what's wrong with kids to what they need to do to be successful in life.
Sure.
Yeah, I just wanted to add one point to that. I think an important aspect of this is to also make sure that the people and the individuals, whether you're an educator or a doctor, truly understand the communities that they're serving. I think that's a really important piece, because I hear what you're saying, and I think in an ideal world, that's exactly where we want to work towards. But it's very challenging to meet physicians who work in communities, and I speak from the healthcare perspective, physicians who work in communities and don't understand the struggles of those communities. You think about physicians or doctors, you go to school, and the first thing you learn is about a diagnosis, right? Like, and the questions that you ask are, how long have you had this condition? When did it start? How did it start? Tell me what the symptoms are. If you are treating someone without understanding the conditions in which they live, then you're not treating the whole person. And the same thing goes for educators. So if you are working in a community in which you know nothing about, doesn't mean you have to actually live there, but you know nothing about, you don't understand adverse childhood events, you don't understand how many homes that are disrupted either by the loss of a loved one, how that impacts the child's ability to thrive. You don't ask the questions. And in many communities, especially in communities of color, the expectation is that you are resilient. You should be resilient. You should be able to cope. You know, whether it is 400 years of slavery and beyond, or whether it is seeing gun violence in your neighborhood, this is how life is. This is the cards that you were dealt. That's how many people of color kind of perceive and walk through the world, that we just have to kind of put on that cape and just deal. If the persons who are rendering care don't have that lens of empathy and sympathy and understanding, how can we reach what we're talking about, you know, from the perspective of where David is going, which I think is the ideal state. So it's very imperative that we look at care, and we look at prevention, and we look at wellness through the lens of equity, but also through the lens of empathy.
And Tracy, I think that's such a key point in terms of providers striving to be more culturally competent. And when we think about barriers to both people accessing sort of physical health care or mental health care, provider sort of individuals' perception of like, is this person going to understand me, or are they really, really going to, you know, feel and understand and empathize with what I've been through, and you know, that sort of really can have an impact on individuals' trust of care. I also think that you both made some excellent points about us having to think beyond the traditional medical or mental health system, because adding more, you know, I'm a clinical psychologist, but the reality is that adding more sort of clinical psychologists or therapists isn't really going to solve the problem. We need to think systemically. We need to think about sort of the different systems in which children live their lives. So thinking about church, school, different community organizations, the family, and sort of taking a multi-pronged approach to services. So I believe we have time. Do we have time for one more question? How are we doing on time? So I'll ask one more question, and then we'll open it up to the audience for some questions. And so proceeding in order, I think that we've talked a little bit to sort of the, you know, how can we be more culturally responsive? But, you know, question 3, like right now the situation is that the majority of children who receive quality care or evidence-based interventions do not use insurance or have private insurance that reimburses out-of-network benefits. How do we ensure that more children will receive evidence-based treatments like cognitive behavioral therapy that we believe are most effective? And so let's have David go first.
Great. So, I mean, I think what's been interesting to me, I think, when you look at the trajectory of therapeutic concepts over time, right? We started off with Freudian notions of the id and the ego and your mom, right? We kind of moved into concepts from there around the therapeutic alliance and how that works to support symptom reduction and relationships in the actual therapy process. And then you had the cognitive revolution starting in the 70s or so, in which folks were really focused on more of the thinking part of the brain, right, instead of the feeling part. And out of that, you have these therapies that emerge, like cognitive behavioral therapies, that are really, really focused on short-term skill development, things like action consequences and thoughts, things like catastrophizing, the relationship between how we think and what we do. And so there is no question that when we talk about evidence basis, these therapies are very effective at doing what they are supposed to do. Reducing symptoms of mental health issues, reducing symptomology in terms of anxiety. And the question, I think, is how do we get more kids into these evidence-based treatments? And I would say the question for me is this balance. Like, how do we teach kids the skills that allow them to be successful at problem solving in life, which are the same components of the cognitive behavioral therapies that you're seeing, right? How does that remove the stigma? Because I think when we're using a medical model of therapy, it is a thing that you have, right? You have anxiety, you have depression, rather than you're struggling to deploy your problem-solving skills, right, around mood regulation, which is a thing we all do and we all struggle with. So the medical-based piece that says cognitive-based therapy, how do we get kids to access this piece? The first thing, we have insurance. I mean, we have Senator Kennedy, Patrick Kennedy has been working on this for a long time, making sure insurance and mental health are included in insurance bills and things like that. And I think those are more technical things that Tracy would speak better to. But for me, it's like, how do we ensure that young people have access to skills that are going to help them thrive? How do we ensure that they're in communities of care at all times? And then, when they get to a place where they're really struggling, how do we ensure that they are receiving the kinds of treatment that works? And let me just tell the difference, right? Because there is a lot of support-based treatment that says, yes, I will be in a therapeutic alliance with you. And the importance of that is that every young person and every person in general needs that, not just therapeutic alliance, but that connection. And I think that's where I'm going with this answer, right? Is like, we are isolating people's relationships and isolating people's connections to these very kind of specific interactions with mental health professionals. And all right, the mental health professional, they're doing a good job. They're going to be saying, let me talk about your acts and thoughts and consequences. Let me make sure, you're narrating your emotions effectively. They're going to do their job, and that's what the cognitive-based therapy is going to allow. But we're missing, I think, the bigger point that every person needs to be connected to a person who loves and cares about them. Right? And it can't be a therapist. We just don't have enough therapies. So that's like my non-technical answer to this question, right, around evidence-based therapies. But I know Tracy probably has more specifics.
No, actually, I don't. And the reason why is because I think we over-medicalize this, if that makes sense. Is that a word? Over-medicalize? Thank you. Yeah, just making sure. In my head, I'm like, yeah, that sounded right. I think we over-medicalize some of this. I think the challenge here is for us, and I say this again, to reimagine health, to not make this the expectation only of that of a specific therapist. I have friends and colleagues who feel that I've abandoned my social work role because I don't do direct practice anymore. And I spoke to a therapist about this, who was a colleague of mine and a friend, and I said, what would you say specifically about this? Give me something good so I can wow the crowd. And what she said to me was, number one, it is removing, some of the restrictions that serve as limits for therapists to do their work adequately. And she's like, that's where you as the payer can come in, right? Because you guys dictate a lot of that. I said, okay, I will take that back and acknowledge that. But I think beyond that, it is figuring out the various places where students, children are having interactions where we're asking them, how are they feeling? How are they doing? Whether it's through play, whether it's through gym, whether it's through sports. I think in all of those activities, we have to step up. We have to become coaches. We have to become mentors. We have to become therapists, not in the traditional sense of being a therapist, but asking people more questions to probe them, to begin to talk more frankly and more candidly about their emotions, but at the same breath, teaching them resilience. Because I agree, I have an 18-year-old daughter. During the pandemic, this is a child who's extremely involved in multiple sports. She's a high achiever. She played volleyball, lacrosse, you name it. I was driving around like a crazy person during her middle school years between work and all of that, but I digress. What I will share is that during the pandemic, she really felt a sense of isolation. She's an academic person, she's on the debate club, and when all those things went away, she realized that she felt a decline. She said, Mom, and she was still doing well academically, but she says, Mom, I need to talk to somebody, right? And I'm kind of like, well, talk to me, right? I'm a social worker as well, and I'm your mom, right? She's like, no, Mom, I need to talk to someone. And I said to myself, number one, I was proud that she felt comfortable enough to come to me and to say she needed to talk to someone. It took me 6 months to find a therapist for her, okay? I am in the field, okay? 6 months to find a therapist, number one, who would meet her needs, who could really identify with her. It took that long. But during that time, one of the things I continued to talk to her about was figuring out and kind of understanding the root of what some of this is, where that's happening, whether that's through journaling, whether that's through, talking with friends. But my premise to this was that while I wasn't her social worker, I tried to remove the hat of a social worker, remove the hat of the parent, and allow her to begin to grow, to figure out what was fueling some of this. Eventually, she did find a therapist, and she did get the help she needed. But one of the things I realized as a parent was I had to be resilient as well and reach out to other parents who were dealing with this challenge and be honest and candid with myself that we can't do it all. We need to rely on the supports of others, whether that's through the church, whether that's through the school. So the long-winded answer to this is that it's not just in medicalizing and giving people a diagnosis, because that's another label, unfortunately, under-marginalized communities have to wear. If you need the help, don't get me wrong, I'm not saying you shouldn't be diagnosed or get the care that you need. But there are some folks who are dealing with anxiety and depression, like many of us, and we still have to live our lives. So those coping skills and those mechanisms that exist to help us are ones that need to exist in various relationships, not just in the medical community.
I'm getting the sign that we sort of need to open it up. Should we open it up to? So I guess I'll make one final remark just to sum it all up. I think that one of the biggest takeaways that I've gotten from these responses is that we really need to think about. We need to think out of the box, outside of the sort of traditional model, and we need to think about how we can, at different levels, sort of ranging from prevention all the way to intervention, to sort of intervene in as many settings as we can for youth. And I think that that's one of there's so many takeaways, but one of the things that I would say that sort of really stuck out to me. So thank you. Thank you so much, Tracy and David.
before we close out our program, and I'm going to introduce Mary in a minute, I really just wanted to take this moment to acknowledge a really extraordinary woman. For those of you who don't know her, this is Senator Teresa Ruiz. Senator Ruiz missed our video this morning because I know you have many other commitments. We talked about all the successes this year, the Driving by 3, the Young Child Tax Credit, the implementation of universal home visiting. Well, the person who's responsible for that is Senator Ruiz, who not only introduced those initiatives, but put her personal commitment, her courage, her tenacity, ensuring
call it the nudge, but you know.
to making all of that possible. Senator Ruiz is the first Latina Senate Majority Leader. She entered that office at the beginning of this legislative session, and I think you have brought extraordinary leadership and commitment to children, especially young children, to that role. It has been, I can't even describe what a pleasure, somewhat of a roller coaster ride. It has been to work with you. I am so excited to introduce you today and to acknowledge your extraordinary efforts on behalf of young children. So let me not drop it.
Oh, I love it.
This is from Grassroots, for those of you who are newer, familiar with Grassroots. It says, thank you for your advocacy on behalf of young children and their families.
Thank you so much. Okay. Good morning, everyone. So I have to take this opportunity to thank Cecilia, because I actually had scheduled to bring her down to Trenton and award her for her time of service as she's retiring, even though I know she's not retiring because I'm going to keep her on speed dial. But I caught COVID and I was like, I can't be there. How can we do it? So I just want to say what I could not say that day was that the state of New Jersey and this country, quite frankly, because New Jersey is setting the model for what we understand to be a key variable in economic success, which is protecting women and children. And that's because of a lot of the work that you have done in your career lifetime and because of all of the people in this room. So congratulations to you and thank you for your efforts. There are so many people in this room. And by the way, I tested negative on Monday in case everybody's like, oh my God, I hugged her. I'm good. Otherwise, my director of policy would know that I would be masked up, but I figure maybe I have like a month to be okay. I don't know. I'm trying to live my best life in the next couple of weeks. We've done some extraordinary things at the state, but of course we know that there's still more to get done. As the panel was wrapping up, as a policymaker, I'm sitting there and I was so grateful that and I'm sorry that I don't have my glasses on, so I can't see where you are, but the mother who's also a practitioner recognized one of the key fundamental things. It's accessibility. And in a space where we're all indebted to making sure that we have equitable spaces for the start and the launch of the human capacity in our child care space, right? How critical it is to understand how not having equity across the board in whatever discipline we're in creates extraordinary barriers and negative outcomes for the future success of that New Jersey taxpayer. That's how I catch this conversation. It's not a K through 12 system. It is not a preschool. It is not a daycare. It is a 0 to New Jersey taxpayer model structure that we have to focus on. If we don't fundamentally govern our policy perspective in that space, we will be paying for those outcomes later in different ways, whether it's through the criminal justice system, whether it's through resources and wraparound services, whether it's through remediation in school. And that's why I've been always so aligned with ACNJ. ACNJ should really stand for ACNJW because I want to throw women in there too. However, what I wanted to say is, as policymakers, we need to recognize we have a shortage of individuals in this space. If you're a family that is on Medicaid, which so many of our uninsured families are in that space, forget about even getting access to someone in the mental health field, because there's so few people in this discipline, and many of them transition to just pay. Even if you had insurance, it was just direct pay, and as you heard, it's 6 months later. We're working on some policy initiatives to be sure that New Jersey starts bringing people into this fold, the same way I've been working on making sure that we are getting the next generation of teacher leaders in this space. You know, we have to think about the fundamental things. We need people in the space. Let's pay for their college tuition. Let's ask them to pay it back through public service. I mean, it's common sense. But as Seal and as everyone will tell you in the room, sometimes common sense on the turnpike gets lost when you're headed to Trenton. It's a matter of issue. I just want to say to you that I know this isn't a political space, but there is a people purpose in this room. And the people purpose is that I always like to end things with. We have to be in all spaces at all times. And that means if you're sitting around a table and you don't see a part of New Jersey making the decision-making process with you, you are being shortchanged with your outcome. I'm the first woman in the history of the state in Senate to give birth while in office. That's terrible, right? I mean, the Senate's been there for like several hundred years. The first one, terrible. What does that say? Not enough women, and not enough women in specific ages. And why does it matter? Because when I was there and I gave birth to my daughter, I had the most phenomenal experience with a nurse lactation specialist through my insurance who came to visit me at home. And I was, you know, it doesn't matter how educated you are. You can have a doctorate's degree. You can have a partner at home. You can be resourced. When you get sent home with that child, it's as if you don't understand English ever in your life. And so I was committed to nursing her. But of course, as you know, you cannot measure. And I was like, I don't know if what I'm doing is right. She came and literally in 5 minutes stripped her down, weighed her. I nursed her for 20 minutes, weighed her again and said, you just gave her a couple of ounces. And that switch from a medical professional gave me the confidence to nurse my daughter for 4 years. Because I knew that my body was doing what it was supposed to do for her, and that connection that we built during that time frame and the levels, it was, for any nursing mother, you know, once you cut it off, then they get sick all the time. And I'm like, you know, when she comes home sick, I was like, I wish I had frozen some more milk or something to see if it would work. But it was that experience that I said, what if every woman in the state could have this? New Jersey has a phenomenal nurse visitation program, but we only get to one cohort of women. But because of the legislation that I drafted, and now that the regs are coming out from the different departments, in the future, everyone who brings an infant home would have at least one visit from a medical professional to check in on your child, and most importantly, check in on you. And I know I've done a lot of great things in the space of early childhood, because I believe that if we make investments early on, the returns will be extraordinary. The numbers that you're going to see come out next year for the state learning assessments are going to be deplorable. And if we don't stand up with courage and with uncomfortable conversation and roll up our sleeves and forget about doing the same things as we were doing before, we're going to lose an entire generation who will not even be able to sit in a room like this and talk about opportunities, because they will be so handcuffed to not being able to function with their God-given potential. From 0 to 3, you learn to read. From 3 and beyond for the rest of your life, you read the agenda for today. If we are socially promoting individuals in the school structure, we are doing a disservice to the state and this country. And I will tell you this, it doesn't happen everywhere. It happens in my zip code. It happens in spaces where children look like me, and African American and Latinas are the ones who are most struggling in this space, because learning loss became something that everybody understood during the pandemic. Childcare industry, oh my God, the daycare is closed. What are we going to do? I said, but have you not been listening to the things I was talking about for the last 10 years? So the pandemic lent a lot of power to all the work that you are all doing in this room, because it highlighted things that we've always known to be a disaster for so many of our families. And so now is a time of reckoning, but there is funding. As we know, there is purpose and there is power. We have to use this time where people recognize that if this door is closed, this woman can't go to work, if that child is not reading, they can't move on. We have to do wraparound services. If that woman doesn't have access to health care and a safe place to live, then all these other domino effects the best return on your investment right here in this room. For every dollar you put in an early childhood infrastructure, you get up to $13 back. I'm not a hedge fund person. I don't know anything about stocks, but I will tell you this. If I went around the room and said, give me $1 and I'll be guaranteed you give it 13 back, I would collect more than $1 for everybody in this room. It's time for government to understand that. It's time for this country to recognize that education should be at the forefront of everyone's conversation, that we cannot have federal bills that don't include funding for early childhood and our school infrastructure. And with that, I would leave you. I'm looking forward. 23 is my favorite number, so I am so looking forward to 2023 to be the year where if you didn't think I had a filter before, watch out, New Jersey. Thank you very much.
Hope you all feel energized and charged for what's ahead. Thank you, Senator Ruiz. And now please let me introduce our incoming CEO, Mary Coogan, who's going to close out our program.
I'm not sure what I can say after that, right? Thank you all for being here. As Seal said, I'm going to be stepping into the President and CEO position come January. So as you heard from Owen and Alice, Seal is retiring at the end of December, but as Charlie correctly stated, she's not leaving the ACNJ family. She never will. But she shall be consulting with ACNJ on the early learning agenda and her real retirement party, because her accomplishments have allowed us to celebrate so many things. We're really having a retirement party on March 29th. And we hope you can all join us. It will be at the Grand Marquis in Old Bridge. There are cards on your table. Okay, just a couple of things I wanted to mention. I think for those of you who have never been to an ACNJ annual breakfast, I hope you had an opportunity to meet some people, make new acquaintances. Everyone in this room is a person who believes that all children and youth should have an opportunity to grow and be safe and healthy and educated. And that's what ACNJ is all about. One of SEAL's legacies is the ACNJ staff, who will continue to promote policies and programs that the research and data tell us will produce positive outcomes for all New Jersey children and youth. So we will continue in that mission. One of the things that helps us, and I couldn't leave this dais without saying it, is your support. So on your tables is our annual appeal card. In it is a insert by which you can make a donation or a pledge. You can put it in the red envelope and give it to Steve Clayton on your way out. It is with your support that we do the work we do on behalf of children and families and are able to support the initiatives that Senator Ruiz mentioned. I would also say we always take an opportunity to advocate. As we all know, the child care system continues to be in crisis. The other thing on your card is information about our Reimagine Child Care campaign. We are looking to have 40,000 people engaged in this campaign by spring. So I would like everybody here to sign up for the campaign. There is a QR code by which you can do it, or you can go to our website. Is Aaliyah in the room? Okay. Aaliyah is our campaign coordinator. If any of you have networks that you could pass this information out to, she can give you additional cards. You can get more information from her. We would ask everybody to engage in this campaign if possible. Okay, so the last thing I want to say is that our first event for 2023 is actually our Trenton Kids Count data. You saw in the video we had a Newark and a Patterson Kids Count data report. We are going to be putting out a Trenton one in thanks in part to our funders. The Burke Foundation is here today, but also the Smith Family Foundation and the Princeton Area Community Foundation. It is with this data that we try to educate policymakers and try to promote those policies that we all know will help support children and families. So that will be January 25th in Trenton. I know Atia Weiss will be speaking. You're all invited. But if you can't make that event, I hope to see you all on March 29th. All right, but thank you again for being here. And on behalf of the ACNJ board and staff, I want to wish you lots of laughter and fun in this holiday season. As we heard from our panel, we all need to have a little laughter and fun. And I think the panel really showed for me how important it is to do the prevention services, to make those connections for children. And I think we all, as you heard from the panel, have a role to play in that. So hopefully you can make some of those connections in your daily work. But thank you again all for coming, okay?